It's pillow talk time today. I've got to admit, talking about pillows is one of the most common things that we get asked about in the clinic, and also it's a topic that a lot of people get really frustrated about because they've bought so many different types of pillows and their neck and their head still feel wrong in regards to the pillow that they're using. So today we're talking all about pillows. So hi, I'm Dr. Beth, osteopath here at Melbourne Headache Solutions. I often get my patients to bring in their pillows so that I can see what they're sleeping on and give them advice in regards to their pillows. And when people bring their pillows in, they're usually bringing in 3, 4, 5 pillows because they're usually just at a loss as to what type of pillow they should be sleeping on. And usually from just eyeballing the pillows, I can tell that at least a couple of the pillows that they've been trying to use are really wrong for them. So I'm sure that my patients are not alone out there. I'm sure that there are a lot of you that are just sitting there going, I have no idea what type of pillow I should be using, but I know that it's just wrong for me. So what am I supposed to be using? So as I said, we're delving into that today. So hopefully you learn a lot about the type of pillow that you should be using. So if you've got any questions, drop them below and I'll get back to you. So when it comes time for a pillow, if you're a side sleeper or a back sleeper, you do actually need a different pillow in regards to the different position that you're sleeping in. If you're a tummy sleeper, then this is a definite no-go when it comes time for headaches and migraines, and definitely when it comes time for neck pain as well, because we do spend an awful lot of time sleeping. So hopefully you should be sleeping 7 to 9 hours. This is the recommended length of time. And if you're sleeping on your tummy, even if you do find that it is a comfortable position for you, then you're turning your head to one side, you're putting a lot of pressure down through it, and it's encouraging dysfunctions to enter into your neck. And as we know, your neck is very strongly related to headaches and migraines, particularly the top 3 joints. So if you're encouraging dysfunctions and biases in through your neck, then you're going to be encouraging your headaches and migraines to come back again and again and again and again, which is obviously what we don't want. So we would acknowledge that if you walked around like this all day, every day, then that would be a silly position. That would be bad for your neck. So we certainly don't want to be doing it when we're asleep. So first and foremost, if you're a tummy sleeper, stop sleeping on your tummy. There are certain ways that you can do this. You can hug a pillow, you can put a pillow between your legs, and also usually if you're a tummy sleeper, then it means that your pillow is too low for you because you're allowing yourself, you're seeking comfort for your head and your neck, and so that's why you usually end up on your tummy. So if you get a taller pillow and be a side sleeper, then usually this stops you from rolling onto your stomach because you'll find it very uncomfortable to sleep on your stomach if your pillow is high enough and supportive enough for your head and your neck in that regard. So you do need a taller pillow most of the time if you are a tummy sleeper. So if you are a back sleeper, often you need a slightly lower pillow, okay? And getting a normal profile pillow, and by normal profile, I mean not the contour pillow, okay? Having a normal profile pillow is quite all right. So with these pillows, then what we want to be doing is we want to be making sure that our head is in a slightly, and I do mean ever so slightly, tucked position. So when you are lying down on the pillow, you want to be making sure that you're looking slightly down, okay? Your eyesight is slightly down. If when you're lying on your pillow, you're looking up towards the ceiling or you can see slightly back behind you, then it means that your pillow is too low and it's not supporting your neck. Okay, so as I said, when you're lying on the pillow, you want to be making sure that your eye line is ever so slightly down, not so that you're directly looking down at your toes. This means that your pillow is way too tall, okay, but so that you're looking more at about like a 45-degree angle or so, but so that you're looking forwards. This means that your pillow is probably at the right height for you. This is a more appropriately heighted pillow, okay? So, and as I said, a normal profile pillow is okay, that's fine. Okay, when it comes time for the density of the pillow, okay, when it comes time for do I get a hard pillow or a soft pillow or that sort of thing, it really comes up to personal preference. Some people really love a hard pillow and that other people really much prefer a softer pillow. But the thing that you're looking for is for something to support your neck. So if you lie in the pillow and you feel like your head is just being like it's lying on a cloud and it's getting really smushed into the pillow, then that's not good. It's not supporting your head. So you do need something with a decent resistance, and as I said, it doesn't need to be rock solid, but something with a decent resistance so that it is supporting your head and your neck. If you are a side sleeper, however, you do need something that fills the distance between your shoulder and your head. Okay, so you often need a much taller pillow than if you are a back sleeper. So you need something much taller so that your head isn't dipping down. This is the most common problem. Most people's heads dip down when they're sleeping. Okay, and this again, if your head is dipping down and you're not getting the support of your head and your neck, this is why most people end up rolling over onto their tummies, because they're seeking that support, they're seeking that comfort for their head and their neck. So you need a much taller pillow if you are a side sleeper to fill this gap here. Okay, this is when the contour pillows really come into play, and some people really love these pillows, some people really don't. Again, it is personal preference. I do recommend the contour pillows because it sits quite nicely to support your neck in here and fills the gap quite nicely in here. But that's where the contour pillows come in, those wavy pillows. Often these pillows have a high side and a low side, and it really depends on the height of you and the build of you. But basically what we're looking for is that your head and your neck are straight when you are sleeping, okay? So that your head is not dipping down, nor is it being pushed up in your sleep. You have two bones in your neck, so you've got one right at the base of your skull, and you've got one right at the base of your neck down here. And we want these two bones to be in alignment when you're sleeping. You can get someone to check you out from behind, or you can just feel them yourself to see whether they're in alignment. And then that means that you are in a good position, okay? But that's what we're looking for a side sleeper. Again, the density of the pillow is less important. So again, if you don't like a rock solid pillow, you don't need a rock solid pillow. But if you feel like you're collapsing into the pillow, this is not good. You need something that supports you along the way. Okay, so that's what we're talking about in terms of pillows. In terms of the pricing of a pillow, just because you bought a very expensive pillow does not mean that it is a good pillow. Everybody is built differently. Everybody needs a slightly different pillow because your shape is different to my shape, is different to the next person's shape. So I might need a slightly taller pillow than you might need a slightly lower pillow than the next person, and so forth and so on. So as I said, it's more about the distance between here to here if you're a side sleeper, okay? And I might be a little bit broader and you might be a little bit narrower. So make sure that you're supporting your neck so that it's not contributing to your headaches and migraines, and you want to be feeling comfortable. One of the most important things that I can pass along to you is that with headaches and migraines, because you've got those dysfunctions in the top part of the neck, a lot of people buy pillows to try to fix their neck problem or fix their headaches and migraines. But just changing a pillow when you've got your neck dysfunctions isn't going to fix your headaches and migraines. It might help it from getting worse, which is fantastic. We want to be making sure that our pillows aren't contributing to our headaches and migraines, but often just simply changing your pillow won't fix your problem. Okay, which is what a lot of people are looking for. They're looking for their pillow to fix the problem. So what we do need to do is make sure that we're actually addressing the underlying cause of the headaches and migraines, which is making sure that we're getting those top 3 joints treated in a systematic and thoughtful manner. Okay, ideally with someone with additional training in headaches and migraines, but making sure that we've got a great pillow that also supports that treatment as well. So make sure that you've got a great pillow, but make sure that you're actually getting the underlying cause of your headaches and migraines treated as well, because you can have the most fantastic pillow in the world, but if your neck is still sore, the pillow won't actually fix the neck problem. You've got to get the neck problem fixed and have a great pillow at the same time. I hope you found this helpful. If you've got any questions or queries, drop them below, let me know. Share it around if you found it helpful, because everybody needs help with pillows. I know that there are a lot of people out there that do. Thanks guys, and I'll catch you next time.